Hello. This presentation, The Concept of Health Assessment, is going to focus on general concepts. Please make sure that you participate in the pop-ups that you see that ask you to answer the questions so that you can get attendance credit. The lesson objectives are describe different types of assessments indicating the purpose of each, demonstrate use of each method of examination, which include inspection, palpation, percussion, and auscultation, and discuss factors required to properly interpret findings from the nursing assessment. Please use these objectives to guide you in your reading and other activities, as our exams will come directly from the objectives. It's not enough just to listen to lectures. You're going to have to afford yourself time to read and participate in other activities as well. So let's start by talking about the registered nurse. As you know, or you may not know, the registered nurse is licensed nationally, just like the practical nurse. However, the scope of practice is wider than it is for the practical nurse. So while we are licensed nationally, it's a different scope for the license. We will practice within the scope of nursing practice and diagnosis, not going above, certainly, and using critical thinking skills. Practical nurses most certainly use critical thinking skills as well. The RN, however, again, it's a wider scope than what the practical nurse uses. Goals of nursing include promote overall health, physical, social, and mental. So we're not just focusing on the problem that the individual is experiencing, but we want to promote overall health. Prevention of illnesses. So we're going to educate on, for example, hand washing, healthy diet, treating the human response to health or illness, and we advocate for individuals, family, community, and populations. So our goals are much more broad than just treating a specific problem. If you haven't already, you're going to hear the two words critical thinking throughout your student career and throughout your nursing career. But what is it? What are we talking about? Well, the American Sentinel University Health defines critical thinking as the ability to recognize problems and raise questions, gather evidence to support the answers and solutions, evaluate alternative solutions, and communicate effectively with others to implement solutions for the best possible outcomes. So how do we do that? We do that by getting into the state of mind that we need to be a critical thinker. For some people, this is an easy transition. For others, it does take practice. So critical thinkers are multidimensional. We need to be fair-minded, suspend judgment, investigate thoroughly or assess, which is the basis for this course. You have to be able to question your own thinking. And ask questions and look for the answers. Admit to your own knowledge deficit. Admit what you don't know. The most dangerous nurse is the one who thinks that he or she knows everything, because we don't. Practice intellectual curiosity. Be a truth seeker, so you want to look for answers until you find the right one, and tolerate other people's points of view. So it's a very multidimensional approach, whether it's to practice for practicing nursing or even taking a test. So when you're taking these nursing exams and applying critical thinking, you have to be able to use these different ideas that they're presenting here. Being fair-minded, suspending judgment, being willing to look for the answers in your readings, paying attention in class, doing what you need to do, and learning how to think critically. So nurses use critical thinking with a process called the nursing process. It works. It's a theoretical framework that we use to make decisions and carry out plans. So as I mentioned, the nursing process is a theoretical framework. The acronym that we use to remember the order of the steps is ADPI. The A refers to assessment, which, as you know, is the basis for this course. The D is diagnosis, We're not referring to a medical diagnosis. This is a nursing diagnosis. The P stands for plan. The I stands for implementation or implement. And the E is evaluation. So the first step, assessment, is gathering information. So we're going to get as much information as we can before we can come to a conclusion. We do this through talking with the patient through interview. We review any health records that are available. And of course, we're doing a physical exam. And we'll get into more detail with this as the course goes on. The second step of the nursing process is diagnosis. Again, as I've said before, we're not talking medical diagnosis, but Jensen, which is a textbook that you don't have, defines nursing diagnosis as a clinical judgment about individual, family, or community responses to actual or potential health difficulties or life processes. So what we're talking about is a nursing diagnosis based on a symptom that the patient is experiencing. I will ask you shortly to look up NANDA approved nursing diagnoses. NANDA was, or actually still is, an institution that develops specific nursing diagnoses that are acceptable to use. We don't make up diagnoses, we choose the one that applies to the situation. But NANDA, the I stands for international, has come up with, there are so many to choose from that it will never be difficult to find one that applies. But just be aware that we use approved nursing diagnoses when we are actually writing care plans. You will get more into using nursing diagnoses and using the nursing process with care planning when you get into future courses. The next step in the nursing process is planning. We come up with individualized interventions. So we're not going to have canned plans. They're going to be plans that apply to the circumstances of each person. They're holistic, and it's basically what we're going to do to address the nursing diagnosis. The fourth step in the nursing process is implementation. So we're carrying out the plan. Jensen, again, the textbook that you do not have, defines implementation as any treatment based upon clinical judgment and knowledge that a nurse performs to enhance patient outcomes. So it's what are we going to do to carry out that plan? And then evaluation is looking back and judging the effectiveness of the intervention. Did it work? How well did it work? What needs to be changed? It could be that the patient's condition has improved and we don't need to give as much pain medication, or we don't need to continue to change the dressing on the wound every shift. So we have to go back and reevaluate what we've been doing. What is health assessment? Your Pearson book defines it as a systematic method of collecting data. So that's what it is. It is data collection about a client for the purpose of determining the client's current and ongoing health status, predicting risks to health, and identifying health promoting activities. So if you remember way back at the beginning, we talked about what the goal of nursing is. So we're determining the client's current and ongoing health status so that we can treat that. We're looking to see what the risks might be to their health so we can hopefully prevent those things from happening. And also we identify health promoting activities so that we can educate and teach. The main purpose of health assessment is to establish a baseline for comparison. Now this doesn't mean that a baseline is once and done. This is an ongoing process, believe it or not. There may be times where you see a patient and you don't have anything to compare it to. They have had assessments before, but you don't have access to those records. So assessment is always an ongoing process, but data that you can collect then can be used maybe 2 hours later, you're checking a blood pressure again. That data can then be used to make determinations on what is changing or staying the same. Types of health assessments that we're going to talk about are baseline, problem-focused, emergency, and ongoing. Other books, even literature on the internet, may refer to these things in a different way. It may call them something a little bit different, but they're all basically talking about the same thing. And I'm going to go over each one of these and refer to them as you see here. So a baseline assessment is going to be usually comprehensive, and what we're referring to is the overall health assessment that an individual gets when they are present to a new facility or a new circumstance. So it's comprehensive, done as soon as possible in case there are changes, and it establishes baseline for future reference. Some examples of appropriate scenarios would be in acute care settings. When a patient is admitted, there is a complete head-to-toe baseline assessment done on that individual. Any new admission anywhere in any facility, whether it's long-term care, outpatient, or if somebody's new to you and you just need to get more information. So a baseline assessment is going to be comprehensive, head to toe, and of course take a lot longer. Problem focused is going to be system specific. So it's going to be focusing on a specific area that is causing the patient an issue. If somebody has a wound, you're going to focus in on that area where the wound is occurring. If they have pain in a specific area, you're going to focus on that specific area. A problem-focused assessment is ongoing because we want to see that the issue is resolving. And it can be thought of as symptom analysis. So a problem-focused assessment is analyzing a specific symptom. Appropriate scenarios, for example, would be shift changes, where you assess whatever the previous shift has reported is a problem to you. If the patient is already known to you and you don't need to do a comprehensive assessment, you're just focusing on those areas that the patient has an issue. If the patient returns from a procedure, for example, they've had a cardiac catheterization and you've got to assess the femoral area for bleeding. So those are just some examples of problem-focused assessment, and there are many examples. An emergency assessment is just that. During any physiological or psychological crisis where there is a life-threatening potential. And it's also to identify new problems. So examples would be shortness of breath, somebody complaining of chest pain, somebody even threatening suicide. So it's something where you determine that there is a potential life-threatening situation, and that's when we're going to do an emergency assessment. Now, we're not talking about anybody who presents to the emergency room, because you can present to the emergency room with non-life-threatening issues. So an emergency assessment you're going to be on guard and alert for whatever the circumstance is that could potentially become life-threatening. Ongoing reassessment happens minutes to months after the baseline assessment, and it's something that we can compare to baseline. So examples would be wound care, when you're assessing the progress of wound healing. Blood pressure, if somebody presented with a low blood pressure or a high blood pressure, it's going to be an ongoing process to see where that stands. And pain control can be another example. So I'm going to present some case studies to you, and you're going to see a pop-up question where you have to choose the appropriate type of assessment for each scenario that is given. And your choices will be baseline, problem-focused, emergency, and ongoing. And I want you, even though you can't describe why you chose what you chose, I want you to think about what made you choose that specific assessment. Case study number 1. PR is a 38-year-old male who comes to the general practitioner's office for a work physical. His medical history includes an appendectomy at the age of 16 and removal of a suspicious skin lesion at the age of 30. The results were benign. Which type of assessment would you perform? And I want you to think about why you would perform that assessment. In the choices, there's not an option for you to explain why. So that's why I'm just asking you to reflect on your answer. Case study number 2, MK is a 30-year-old female who is admitted to the maternity unit, status post-cesarean section. She has given birth to a healthy baby girl. The nurse is taking vital signs when MK states that she is feeling short of breath and has severe chest pain. So which type of assessment would you perform? Case study number 3, JD is a 16-year-old male who presents to the emergency room after falling off his skateboard. He is alert and oriented ×3. He was wearing a helmet and states that he landed on his right arm. He's grimacing and states that he can't move his right arm or hand. So which type of assessment would you perform? Now we're going to talk about types of assessment data. Subjective refers to symptoms or covert data, and it can only be described by the patient. So subjective data would be somebody telling you that they feel like they're itching, pain, or they tell you that they're worried. We can assume that somebody's having a problem with itching if we see them scratching, but we cannot objectively assess that the person feels itching. We can only describe that they're scratching. Okay, so subjective is where the subject tells you what they're feeling. Objective is where there's signs or overt data, and that's something that you see. So it's detected by the nurse or the observer, and some examples would be skin color or a blood pressure reading. I don't want you to get confused by objective data written in a chart. Just because you read that somebody is 45 years old doesn't mean you can see that they're 45 years old. So objective data is what you are observing on the individual and not what you're reading in a chart. So make sure that you keep that straight. So what I want you to do is read down through these 7 examples and determine whether or not the sentence is subjective or objective data. In this section, I want to talk about assessment techniques. And the techniques that we're going to talk about are inspection, palpation, percussion, and auscultation. Inspection involves assessing the patient visually, so you're using your eyes. And what we're looking for when we inspect is symmetry, which means if you're looking at 2 extremities, are they equal in size? You can see in this picture, if we're looking for symmetry, they are asymmetrical. Obviously, this leg is bigger than this one. We're looking for discoloration. Again, you can see an example in here. This leg appears to be more red than this one. Any kind of breaks in the skin. So it doesn't look like this person, well, possibly there may be some breaks in the skin here. Edema, which is swelling. This leg is clearly more swollen than this one. Skin appearance, whether it's dry and flaky. And the other thing that we look for is distension. This is an example of a distended abdomen. You can see that this man looks like he's pregnant. I don't know what his circumstance is, but he may have what's called ascites, where you get fluid build up on the abdomen for various reasons. It can be from liver cirrhosis, potentially cancer, but that's what we're talking about when we say distension. Palpation involves assessing the patient with touch. And what we're looking for when we palpate is we're feeling for the texture, the temperature. I want you to notice this person is using the back of his or her hands when assessing temperature. That's because the backs of our hands are more sensitive to temperature. And we'll be doing more with that when we actually begin the skin, hair, and nail assessment. Moisture, size, shape, location, position, any kind of vibrations or tenderness. The next technique is percussion, which involves tapping the patient to produce a sound. When we tap the patient, we actually tap our hand, put our hand on the body part and tap with the other to produce a sound. And what we're doing is listening for different sounds that may vary from normal. When we listen or when we percuss healthy lungs, for example, we would expect that sound to be resonant. That's the term for it. Now we're going to get into all of these specifics when we get to that body system, but at least you've heard it here first. We're listening for tympany, which would be the normal sounds for the abdomen. A dull sound would be over the liver, and a flat sound would be over bone. So we can determine a lot of what's going on inside the body based on percussion. And the last technique that we're going to talk about is auscultation. And that involves listening to body sounds with a stethoscope. And we use auscultation to listen to blood pressure, lung sounds, heart sounds, and abdominal sounds. So that concludes this presentation. Please make sure that you have answered all of the questions from the pop-ups from within this lesson so that you can get attendance credit. You are responsible for knowing this information. Make sure that you took notes or that you go back and review the lesson again, and I will see you in class.